Hello, are we live?
Well, it seems like it.
Well, welcome to the Haas live event. We are, well, I think now maybe we're live. We're here today because of International Overdose Awareness Day. So we are going to talk about overdose awareness and then train folks on how to recognize and administer naloxone. And then if anybody has any questions, please feel free to put that in the chat box or in the comment section. But first, I think we should probably do intros.
Yes.
So,
hello, everyone. My name's Frida, and I am the Harm Reduction Coordinator at HAAS, which is Healthcare Alternative Systems.
And then my name is John Wording. I am also a harm reduction coordinator here at HAAS. So, Frida, what do we do? What's our day-to-day like at Healthcare Alternative Systems?
Yeah, so we have very different day-to-day actions that actually take place, but some of it is doing training for naloxone use. And what we'll also be doing is I'll be translating in Spanish for hopefully some of our people that are Spanish speaking. I'll be translating and I'll be going from Spanish to English, so you'll see that throughout the video. So voy a empezar por introducirnos. So yo soy Frida y este es mi colega John y estamos aquí hablando con todos ustedes porque es el Día Internacional de Sobredosis y de traer atención sobre todas las sobredosis que están pasando y también informarles sobre el entrenamiento de la naloxona y cómo usarla.
Cool. So we are here today because of Overdose Awareness Day. And let me know whenever you need for me to pause. International Overdose Awareness Day is it's a yearly event at the end of August to recognize all the individuals that we have lost because of OD, and that could be opioid overdose, it could be overdose on any number of substances, and then of course to celebrate those who have survived an opioid overdose.
Mm-hmm. So, ahorita estamos con todos ustedes porque el día de agosto 31 es cuando queremos reconocer las vidas que hemos perdido de personas que han pasado por sobredosis y también por personas que han sobrevivido cualquier forma de sobredosis. No tiene que incluir nada más los opioides, pero otras drogas también. Y por eso estamos tratando de hacer este tiempo para reconocer este día.
Cool. Yeah. And then I guess one of the biggest tools that we have in the fight against opioid overdose in particular is naloxone, which we will get into momentarily. But that is the antidote that we pass out. So Frida and I pass out and distribute naloxone for free in the city of Chicago. So we'll go throughout the entirety of the city of Chicago, wherever people need it, and then we will train people on how to administer the naloxone and also give out naloxone for free. And there's a couple of different versions of naloxone, but the one that we give out is the intramuscular, which looks like this.
Yeah, and it often comes in a package like this because we want to protect it from any rays of the sun and also want to keep it room temperature, things like that.
Mm-hmm.
Pero sí, unas cosas de las que hacemos es hacer entrenamientos de la naloxona porque este es el antídote que se puede usar si alguien está pasando por un sobredosis de opioides o puede ser como heroína y cosas así. Esto se usa en esos instantes y nosotros entrenamos a personas. Entrenamos a personas ahí en la calle, estamos encontrando a personas que lo necesitan, pero también entrenamos a personas que están en la comunidad y que hacen estos tipos de servicios.
Mm-hmm. Yeah, and one of the unfortunate issues at hand is that we have already seen a surge of overdose in Illinois and in Chicago, and this was true from what we can tell with some public health data in 2019. But as folks probably know, we are in a global pandemic with COVID, which has caused a lot of barriers to access these services. So all that to say is that we are seeing a lot more opioid overdose right now in Chicago than we have in previous years.
Definitely, and that's something that we know we've had barriers, and people with substance use dependencies have had barriers already, even pre-COVID, but with COVID, they have just been enormous, and there's different levels for it. Unfortunately, maybe some of the services that were provided before haven't been able to, but yeah, we found that this is just information that we want to pass out to as many people. Algo que está pasando es de que los números de sobredosis han sobrepasado los del año pasado, y lo que nosotros queremos hacer es traer esta información y dejarles saber a personas de que desafortunadamente esto está pasando, y queremos traer más información para todos.
Yeah. Okay, so do we want to do a naloxone, like walking through kind of some signs of OD and how to administer naloxone?
Yeah.
So when a person is experiencing, so the way that we describe an overdose is essentially when there's, and we're going to be talking about opioid overdose particularly for this live stream. It is very possible to overdose on other drugs or other substances, but for the purpose of this training, we're going to specifically be talking about opioid overdose because we have the medication and the antidote in order to reverse that.
Sí, en este entrenamiento nos vamos a enfocar en los opioides en las sobredosis que son de opioides, porque la naloxona es lo que ayuda a alguien si está pasando por una sobredosis de opioides.
So a very common sign that a person is experiencing an OD, an opioid overdose, or like starting to slip into an opioid overdose, is nodding. They start to become unresponsive, and then their breathing slows down. So those would be one of the more immediate noticeable effects of an opioid overdose. And accompanying that could be a couple of things. It could be unconsciousness. It could be, it's called cyanosis, or the discoloration in the fingertips or the mouth or the lips. And these all contributed could be a good suggestion that a person is slipping into an overdose or currently in an overdose.
Mm-hmm. Yeah, that definitely is something that happens when someone's going through an overdose. The oxygen is not getting to the right places. ¿Cómo saber y cómo reconocer si alguien está pasando por un sobredosis? So hay unas cosas que nos pueden dejar saber. La persona ya no va a estar consciente. Esa va a ser una que les puede dejar saber a personas, y no va a estar respirando. So, el pecho no se va a estar moviendo, y algunas veces también las extremidades de las manos o los dedos se pueden hacer azules, y eso pasa porque no están recibiendo el oxígeno necesitado por las drogas que habían tomado la persona. So, esas pueden ser unas señas y cómo podemos notar si alguien está pasando por un sobredosis.
Mm-hmm. Yeah, and this can, one of the things that we tell a lot of people too about an opioid overdose is that, time is against you, right? So if you are with a person and they start to nod off, or if they become unconscious or unresponsive, you can respond almost immediately. But time is not your friend, especially when if you meet somebody like in the street or on a bus or something. If you come upon a person who's ODing, it's they don't have a lot of time between experiencing and becoming unconscious and suffering some really unfortunate consequences like brain damage or death.
Mm-hmm. Lo que pasa es de que cuando alguien está pasando por un sobredosis, el tiempo está contra nosotros. Por eso se necesita que administrar la naloxona lo más rápido posible, porque la persona está perdiendo el oxígeno, y es importante saber y que están recibiendo la naloxona, por eso.
And please, if anybody has any questions about what we're talking about today, just go ahead and put them in the comment section. We will ask any questions, or we will get to them, as they come in. So please put them in the comments, and we will answer them if you all have them.
Sí, si alguien tiene preguntas, por favor, déjenos saber, las vamos a estar respondiendo.
So the reason why we bring up time, and the reason why is because if you recognize, like after this live event, if you say, hey, I recognize that a person that I came upon isn't breathing, or they look like they have discoloration in their extremities, we would then encourage you to then administer naloxone. So that would be the first signs before you get into actually administering naloxone. We wanted to cover those, if that makes sense.
Oh yeah, definitely. So algo que queremos ver es reconocer si alguien está pasando por un sobredosis para después administrar la naloxona.
Cool. So I guess the first, so what we tell people when they've recognized an OD, we tell people 1, 2, and 3. So these are simple steps that you do when in order to respond to an overdose. So the first one would be administer naloxone. The reason why we put that first as opposed to the other steps is because of that thing we said about time. Again, time is just not your friend in these moments in an overdose crisis, so we want to get that naloxone into their body as soon as possible.
Yeah. So rápidamente queremos responder. Hay 3 puntos en los que vamos a tocar y en cómo usar la naloxona y cómo administrarla y qué hacer, pasos que tenemos que hacer después.
Cool. And then and we'll just go through all the 3 steps, and then we'll actually show you how to do the naloxone.
So vamos a pasar por los 3 pasos y después les explicamos cómo usar la naloxona.
Cool. And then the second step, which is really important, is calling 911. Or if you're with a person, you can say, I'm going to do naloxone, you call 911. And the reason why we want to call 911 is because often is the case a person needs medical attention or to be observed by medical professionals after experiencing an OD.
So el segundo paso, ya cuando alguien administra la naloxona, es tratar de llamar al 911. Es importante porque queremos profesionales médicos cuando alguien pase por un sobredosis. Si alguien, hay que decir, si hay más de una persona puede administrar la naloxona y la otra persona puede llamar al 911 o administrar la naloxona y después llamar al 911.
Yeah, and I mean, just it's kind of we know that calling 911 can take time, which is the reason and naloxone, and we'll get this into a little bit later, but naloxone does take a few minutes for it to work within the body, so it can take up to 3 minutes in order to do its job. So which is why we want it to be done first and then 911.
Sí, ¿por qué usamos la naloxona primero? Es porque puede tomar un tiempo, se dice como 2 a 3 minutos para que la naloxona empiece a trabajar en el cuerpo y por eso es importante administrar la naloxona y después llamar al 911 porque otra vez el tiempo está contra nosotros y tenemos que asegurarnos de que la persona está recibiendo atención médica como la naloxona y después cuando llegue la ambulancia van a recibir este medicamento profesional.
And then the third and final step, of course, would be doing rescue breaths. So a lot of people would probably know it as the first part of CPR. So it's mouth to mouth. And when somebody isn't experiencing an OD, their body is, I think we said, it's starting to deplete itself of oxygen. So we need to get some oxygen back into their body, and that's going to stave off death, or it's going to stave off maybe like permanent brain damage.
Sí, como habíamos mencionado antes, la persona no está recibiendo el oxígeno necesitario, so el tercer paso va a ser boca a boca. So queremos ayudarle a que respire y muchos de nosotros lo conocemos como CPR o rescate primero, pero queremos hacer la parte de respirar por la otra persona para que empiecemos a darle oxígeno.
And we know it can be kind of we know people are hesitant to do mouth to mouth, but I really don't want to. I really want to make sure it's known that this is an extremely important part of responding to a suspected OD, right? So, you know, there's often some kits that come with mouth guards that you know will help people feel more comfortable doing mouth to mouth, especially with a stranger. There's also some other more like homemade ways you could do mouth to mouth. You could take a plastic bag and poke a hole in it. Just whatever you need to do in order to feel safe, we recommend. But it is really important that mouth to mouth is given if a person is not come out of their OD yet.
Sí, y también estamos mencionando sobre el virus de corona y eso cómo está relacionada en el tercer paso que tenemos que hacer, dándole boca a boca a la persona, ayudándolos a respirar y alguien haciéndolo por otra persona que a lo mejor no conoce tan bien, pero es bien importante hacer este tercer paso porque es lo que le va a ayudar a la persona otra vez a agarrar un poco de oxígeno en su cuerpo y no tener muerte cerebral.
Cool. Yeah. So, and those are the 3 steps. Is there anything that we're forgetting or I'm forgetting about the 3 steps?
Well, maybe before we actually go into administering naloxone is how can we check if a person's truly going through an overdose. So there's a couple ways. It depends whether there's a person that's using that you know, or the person that you don't know is probably and you're probably thinking that they're going through an overdose. So announce yourself, letting them know that you're there and that this is something that you can do. The person may just be sleeping, but we always want to ensure that the person knows that we're there and that we are trained to provide the naloxone. But we can do that by voicing that and by also using our knuckles and doing a sort of sternal rub or doing it right above the lip. It is supposed to hurt so that the person sort of gets stimulates. But yeah, that's one way.
Yeah.
Am I forgetting?
No, absolutely, yeah. So yeah, if you see somebody who's ODing, you don't want to immediately just administer naloxone. Frida's absolutely right. You want to ask them. Maybe you can shake their shoulder. You can call out to them. You can say, hey, my name is John. It seems like you might be in an OD, and if they respond, then that's a good indication that they're not experiencing an OD.
So antes de administrar la naloxona y ya checamos esos tipos de cosas que pueden estar pasando en la gente, es de que tenemos que todavía checar si la persona a lo mejor está durmiendo o no está respondiendo. Pero unas formas que podemos hacer es agarrar nuestra mano y darle un poquito fuerte aquí en el pecho o arriba del labio para tratar de estimularlos. Porque si están estimulados todavía es de que todavía no han pasado por un sobredosis, pero si no están estimulados y no les está dando efecto, tenemos que administrar la naloxona.
Great. Cool. So some information about naloxone too. So naloxone comes in really 2 forms. So it's going to be an intramuscular form, which is like this, or there's also a nasal spray form, which we're lucky in Illinois to have what's called a standing order, and people can go into their local pharmacy and they can have access to the nasal spray once per month for free, which is a really amazing resource.
So hay diferentes tipos de naloxona. La que tenemos enfrente de ustedes es la intramuscular, esa se administra al músculo, pero hay otra que es nasal. Y esa nada más es como un spray, que va adentro de la nariz y también esa se puede usar. Y hay una orden en donde una persona puede ir a la farmacia y recibir la naloxona de spray en la farmacia.
Yeah. And this form is going to be the most. So we have a number of agencies in the city of Chicago that will pass out this form in particular, and the one that we get ours from is Chicago Recovery Alliance. So they're a community partner with Haas. They give us the naloxone, and then we go out and then we distribute it to our own clients or participants, and then on the street with the various other agencies.
Exactly. So hay diferentes agencias con las que trabajamos. Con la que nos da es CRA, Chicago Recovery Alliance. Es una organización que nos da la naloxona y después nosotros la llevamos y se las damos a personas que la necesitan.
Cool. And I mean, you know, to be completely honest, the reason why we pass out this form is just because it's the most cost effective. For naloxone can be pretty expensive, but we want to make sure that people have access to it regardless of the cost. So the little vial and the intramuscular syringe is the most cost-effective version that we have available to in Chicago.
Y la única razón por la que tenemos este tipo de naloxona es porque es la que cuesta un poco menos y podemos darla mucho más a menudo.
Yeah, cool. So in this form, what we do is that, following our steps, so we have recognized that somebody has fallen out. We double check to see if there's responsiveness. Maybe we've done that sternal run. Now we've identified that this person is most likely experiencing an OD, and we can move on to the first stage, which is administering naloxone. So in this form, which Frida showed earlier, comes in these brown packs. You take one out. You take your intramuscular syringe. You give it just a little quick twist, just in case that it's loose. Then you take one of the vials of naloxone provided. They should all have this little orange cap onto it. If it's not used, you want to pop that off. Turn over the vial. You can pull back a little bit on the syringe, the plunger, so that the reason why we do that is because you can put a little bit of air back into the bottle, and that just makes it dry up easier. But if you don't have time to do this, if something's ODing, don't worry about it. But you can pull this back, and then you want to take out 100% of the contents of the vial. So one of these vials is 1 dose of naloxone, and then there's only 2 spots where you inject naloxone in this form. You want to inject it into the side of the arm or the side of the thigh. So you have these nice long muscles on the side of your arm and the side of your thigh. Those are the only 2 spaces where you want to inject an intramuscular shot of naloxone. No butts, no heart, none. I heard under the tongue once, none of it. So just side of the arm, side of the thigh. Here, I'll give this to you so that you can go through the demonstration in Spanish.
Yeah, perfect. And when administered, it's just at a nice 90-degree angle.
Yeah.
That it goes into it. I'm not sure if we mentioned that. But great. So lo que hacemos es de que nos aseguramos de que la persona está pasando por una sobredosis y tratamos de estimularlos y no están respondiendo. Esto es cuando administramos la naloxona. So, con la naloxona y con los kits que nosotros damos, sacamos la jeringa y el medicamento. Ya cuando tengamos el medicamento fuera, hay una capa anaranjada aquí, se la quitamos y la jeringa a lo mejor la tenemos que ajustar un poco de arriba. So, lo que hacemos es la apretamos de aquí y después volteamos el medicamento para sacar todo, porque una dosis de aquí es lo que necesitamos en la jeringa. Podemos sacar, le podemos poner aire cuando le estamos insertando, so, lo ponemos aquí. Y en la ventanilla que vemos ahí es en donde vamos a poder ver que estamos sacando el líquido solamente. Y como vamos a poner el medicamento adentro del músculo, no de la vena. So, cuando lo administramos, no importa si hay aire o no, porque no estamos poniéndolo en la vena. Lo queremos poner en el lado del brazo, en donde hay músculo, y en la pierna, también al lado. No puede ser en otro lugar, no lo tenemos que poner en la espalda o ningún otro lado, nada más el brazo y la pierna. En esos músculos queremos. Y ya cuando lo pongamos en 90, en un ángulo de 90, directamente para abajo, también pueden tener la persona su ropa, so no importa, alguien puede tener su ropa, no se la tienen que quitar, puede ir directamente por la ropa.
Yeah, and I think you mentioned that Because a lot of people ask us, do I have to tap out the air in the syringe? And because it's an intramuscular dose, you don't have to worry about the air in the syringe afterwards, right? You can just inject it into the muscle. It's not an intravenous, it's not in your veins, so it's not going to do any damage.
Exactly.
Yeah,
and it can go right over your clothes.
Oh yeah, big, yeah. Please don't undress anybody. It can go right over jeans. It can go right through shirts. It gets really cold in Chicago, so if somebody has a big jacket, you can take off the jacket off their shoulder and inject it, or you can inject it into the side of the thigh.
Exactly.
Yeah.
Perfect.
Cool. And then I guess some Naloxone facts. You can absolutely give multiple doses of Naloxone if needed.
Yes.
So people often, they might require, depending on their body size, depending on the substances that they took, it is quite possible that a person needs multiple doses of Naloxone, which is why in our kits we give out 3 to a bag. So, it is completely safe. Somebody might not react immediately to, it depends on a bunch of factors, but once you inject it, a person might not be responsive for the 3 minutes. So if at the end of that 3 minutes they're still not responsive, you can go ahead and give another dose of Naloxone. But it is also common that after injecting a person with Naloxone, they come to, within a minute or something like that.
So hay veces que personas van a requerir más dosis del medicamento. El medicamento sí toma 2 o 3 minutos que empiece a trabajar adentro del cuerpo, pero si no está trabajando y si no estamos viendo que la persona está respondiendo, tan siquiera un poquito, podemos administrar más naloxona para ayudarle a la persona a recuperar.
Yeah. And we didn't really get into this beforehand, but we can just talk about it now. Naloxone has one job. It's all that it does is get into the body and it bumps opioids off of the central nervous system, so off the brain and the receptors in the spinal cord. That's all it does. So what that means is that it doesn't typically have a lot of known side effects. They're I'm not going to say none, but it's very, very safe to use. It could be used on pregnant women. It could be used on children if needed. It's very, very safe. But it has that just one job, bump the opioids off the brain so that the body can resume breathing. The only problem is that if a person is opioid dependent, it is most likely going to put them into withdrawal. So the more doses that you give a person, the more likely it is that they are going to feel pretty severe withdrawal.
So, naloxona nada más tiene un trabajo, y el trabajo de la naloxona es quitar los opioides del receptor del centro nervioso para que empiece la persona a respirar. Lo que puede pasar es de que puede ser saludable para todos, o también se la podemos administrar a alguien que está embarazada. Todas esas cosas es algo que puede trabajar a todos. La única parte es de que si alguien está dependiente en opioides, es de que van a tener va a ser un poco más difícil para ellos porque les va a dar algo que se llama withdrawals cuando estén agarrando el medicamento de la naloxona.
Yeah, and the knowing that a person is probably going to be experiencing withdrawals is also really important, because when they come to, they're probably going to feel bad. And if a person again is dependent on opioids, they might want to use more of whatever drug that they were using. And we have to, as advocates, try to encourage them not to use any more drugs. And this is, depending on whether or not a person wants to go to the hospital, that's obviously up to individuals, but it's easier to monitor a person in a hospital setting. But for a lot of reasons, people might not want to go to the hospital. So we must, in a lot of cases, must be prepared to see them or monitor them for about 2 hours.
So, lo que pasa cuando alguien está dependiente en opioides es de que van a necesitar y van a querer otra vez tomar drogas, porque la naloxona los quitó del centro nervioso y ya no están recibiendo por lo que estaban usando la droga. So, es necesario de que, si es posible, de que reciban atención médica porque van a ser entre 2 horas que necesitan atención médica porque puede regresar también la sobredosis, because the overdose can definitely come back.
Absolutely, yeah. Naloxone can wear off after about a half hour. So yeah, yes, we don't want people using any more drugs and then they have to be monitored because the naloxone can wear off again. And they'll either need another dose because we don't want people to get revived just to OD after we left, if that makes any sense. Yeah. Cool. What other frequently asked questions do we get about naloxone?
Yeah. Can naloxone be used for any other drugs? So that's one question that's like, well, how do I know what the person's taking? We can't ask them. They're unresponsive. So one thing is we tell them is still use naloxone. They might be using multiple types of drugs at that time. So it will not hurt if the person received naloxone.
Yeah. So, but it only will work on the opioid. So if a person is taking, for instance, like benzos and opioids or alcohol and opioids, it's only going to work to reverse the opioid overdose, which is really, really important, so still give it to them. But it's not, if somebody's only taking benzos, for example, it's not going to work, which is why 911 would be the most important thing in that moment.
Exactly. So, algo que siempre nos preguntan las personas es de que si este puede ser un antídoto para otras drogas o para otras sustancias que están tomando. So, desafortunadamente la respuesta simple es no, pero todavía queremos administrar la naloxona porque puede ser de que la persona esté mixteando, esté usando diferentes sustancias y aunque no va a ayudar por las otras sustancias, si la persona tomó opioides, eso le puede ayudar para si alguien está pasando por la sobredosis de opioides.
Mm-hmm. It's completely legal. It's legal to have. We have Good Samaritan laws in Illinois that protect us from administering but also having naloxone. So that's a really important law that I think more people need to be aware of. It's completely legal to have this and then to administer it. And then if you were to administer it, you can't get in any trouble for administering naloxone either.
So hay una ley también que protege a las personas que están administrando la naloxona y esto les ayuda por si tienen el kit de la naloxona con la jeringa y el medicamento, no les pueden hacer nada porque están entrenados para administrar la naloxona. So esta ley está protegiendo a toda la persona que lo está usando.
Yeah. And then another aspect of the Good Samaritan law that I think is really important is that people who call 911, so the person who, if somebody's ODing and you call 911 and you have drugs on you, or the person who's ODing has drugs on them, depending on the amount, there's protection under the Good Samaritan laws against drug possession. So they can't be charged with, and that's really important to know that you can't be charged. You still might be able to be arrested, but we're trying to work that out with some policy and legislation in the city of Chicago. But if I believe it's under 3 grams of a number of different substances, you cannot be charged with drug possession, minor drug possession. And that's really important because we know that people who might be using drugs are afraid to call the police or call 911, in the emergency. So that is some really important protection for folks.
Sí, y en esta ley es la ley del buen samaritano. Y en esta ley está protegiendo a la persona que está administrando la naloxona y si llama por atención médica también están protegiendo a la persona. So, si alguien tiene cualquier tipo de drogas, puede ser de que son 3 gramos o menos, no les pueden poner cargos a la persona que están llamando. Pero sabemos de que la palabra cargos puede ser un poquito diferente. No estamos quitando la opción de que a lo mejor las personas sean arrestadas. So, con eso en mente, es información de que siempre les queremos dar a personas.
And we actually got a question, and so it says, how do I store naloxone?
That's a great question. Yeah. So with this medication, it is said to have it in room temperature and away from light. So that is why it is in this very dark kit. But it very much depends. I think I've seen if it gets too cold or below a certain amount, it can be thawed out and it can be used, which is, I believe, for the nasal one that I've seen. Because we know that the people that may be using them might not be able to properly store these, but they can still be used. And even expired naloxone,
That's a good point.
we would want to use it as well, just in the chance that it can be effective and it can work for the person at that time.
Yeah, and I think that there's a recently released study that shows that the expired naloxone is still good for a couple of years after the expiration date. So if you have, that's all you have, still use it. It's still going to do something.
Mm-hmm. Gracias por la pregunta. Nos mandaron una pregunta sobre cómo podemos guardar nuestra naloxona. So, está en este tipo de cubierto porque no queremos de que esté en luz directa y también lo queremos que esté en temperatura de cuarto. Por esas razones, pero sabemos de que dependen las personas, a lo mejor no van a poder seguir estas instrucciones. Saber de que si llega a ponerse muy frío, también lo podemos dejar de que se deshaga y lo podemos usar otra vez. So, hay opciones, nada está directo y si está expirado todavía lo podemos usar. Tratar de usar porque a lo mejor también puede servirle a la persona en estas situaciones.
Cool. We actually got another question. Is naloxone addictive? Thank you, Linda, for submitting your question. Nope, naloxone is not addictive. It's a non-addictive antidote medicine. So again, it has one job where if a person has opioids in their system, it is going to bump off the opioids off their brain. But in fact, what generally, like we said earlier, what people really do experience is withdrawals from naloxone. So if anything, it's keeping the person from feeling the effects of the opioid.
Mm-hmm.
Good question.
Sí, nos dieron una pregunta sobre si la naloxona es adictiva. So, no, la naloxona no es adictiva, está ayudando contra los opioides que están en el cuerpo de la persona, pero no son adictivas. And we have another question. Thank you so much. Where do I get naloxone? Thank you, Paola.
What a great question.
Yeah.
You can get it from us. So we get it from Chicago Recovery Alliance with our partnership there, and then we pass it out. So we work with anybody, and we can give some contact information probably at the end of where you can get it. But we can come out and distribute it. If you feel comfortable, you can come to one of our sites and get it. You can also get it from Chicago Recovery Alliance yourself. You can also get it from Prevention Partnership. They or the West Side Opioid Heroin Task Force. They pass it out, and they actually consistently have not only the intramuscular but also the nasal spray. So if you much prefer the nasal spray, you can do that. And of course, if you want the nasal spray in particular, you could always go to a pharmacy and get it.
Exactly.
That does cost a copay, but depending on your insurance, and if you have public insurance, for example, it should be free.
Mm-hmm. So, recibimos una pregunta que es muy buena porque siempre nos hacen esta pregunta. Gracias, Paula. Nos hicieron la pregunta sobre en dónde pueden agarrar naloxona, en dónde está disponible de nosotros. So, nosotros les podemos dar la naloxona, les vamos a dar nuestra información de contacto y cómo agarrarse en contacto con nosotros, pero nosotros agarramos la naloxona de otra organización que se llama Chicago Recovery Alliance. y ellos tienen una localización en el oeste y en el sur de la ciudad y también se las dan al público y trabajamos con otra organización que se llama Prevention Partnerships o Westside Heroin Opioid Task Force y ellos también pasan la naloxona. Ellos tienen localizaciones en la ciudad, en el oeste de Chicago y también la pasan directamente al público.
Do we have any? Do you think of anything that we maybe forgot to mention? Otherwise, we're gonna I think move on to our candle lighting.
Yeah, I think those are what we frequently talk about.
Cool, yeah. So thank you all so much. And if we missed anything, or if you have any other questions, please feel free to reach out to us, either on the Facebook. You can always reach me. My email is jtwerning@hoscares.org, or you can call our Armitage site, and you can ask questions for me.
Sí, si tienen cualquier pregunta, nos pueden contactar. El correo electrónico de John es jwerning@hoscares.org y el mío es fenriquez@hoscares.org y hoscares.com es HASCARES.org.
And before we hand it off to our wonderful colleagues, if you have lost anybody to overdose and you would like us to light a candle in their name, please you can leave the comment in the comment section. You can private message if you want us to do that instead, and then we will light a candle behind us for the loved one you lost, or anyone that was affected by overdose.
Sí, si tienen personas que han perdido por una sobredosis y quieren que prendamos una luz para ellos, lo podemos hacer hoy. Mándenos el nombre de la persona y la podemos leer hoy en nuestro tiempo aquí.
We actually had one last question, limits to purchasing naloxone, from Jonathan. Limits to purchasing naloxone. I mean, I don't really think that you can purchase it. You can get it at a pharmacy or you can get it for free. And some, depending on, we can give it to you for free. So it really shouldn't cost you much or anything, at least if you're in Chicago or Chicagoland. But it can be hard to access just because, agencies might not have it as often as we'd like. So that is certainly a barrier to access, but as far as buying, you should be able to get it for free.
Tuvimos una pregunta sobre limitaciones de obtener la naloxona. No hay ninguna limitaciones que nosotros sabemos. Personas pueden seguir obteniendo la naloxona. Si tienen asistencia médica pública, pueden recibir la naloxona gratis. Y de parte de nosotros, siempre nosotros podemos darle la naloxona también. Definitivamente puede ser algo difícil para algunas personas, pero por eso hay organizaciones como nosotros que les podemos dar esa asistencia.
All right, Joe. Well, thank you very much, and we will see you very shortly.
Yeah.
We'll hand it over to the lovely Renee and Jose.
Yeah. Thank you.
Thank you.
Hi everyone,
How y'all doing?
I'm Renee. This is my colleague Jose. I'm the manager at our residential facility, and Jose runs our recovery home. And we're just here to have a dialogue to remember those that we have lost that have been affected by overdose. We want to remember them for the good times we had with them, the laughs we shared, all the amazing qualities that they had and the time that they spent with us here, sharing time And we also want to light candles for those that are still out there in the middle of their battle, still being affected by this daily. We want to take a little bit of time to really slow down and think about those we've lost and those that are still fighting.
Do you want me to translate?
Yeah, you can translate.
See that you left. What happened? Buenas tardes. Mi compañera aquí se llama René. Ella es la manejadora del programa de 28 días aquí en la residencia de Haas. Y yo soy José Carabeo, soy el manejador de la casa de recuperación. Estamos aquí porque queremos prender una vela para la gente que falleció al caso por sobredosis, y queremos recordarlos en una forma más positiva, no nomás que pasaron por nuestros programas, pero de una forma de que ellos fueron más que una persona que falleció por una sobredosis. Y el día de hoy vamos a prender estas veladoras para poder recordarlos y en una forma positiva.
So I'm going to start with the first candle. I want to take time to think about all of those clients that I have fought side by side with, and unfortunately they have passed on due to overdose while they were still engaged in their recovery and trying to find their way to a better life. So I'm going to go ahead and light that candle now for all of those that we've lost that have come through my residential program.
Dice la señorita René que ella va a prender la primera vela, va a prender la vela para los participantes con las que ella peleó la batalla de la adicción, y yo ahorita prendo otra. Yo voy a prender la vela para también los participantes que pasaron por mi programa. En los 7 años que he trabajado aquí en esta agencia, desgraciadamente hemos mirado muchas personas que han pasado por aquí y muchos de ellos han perdido la batalla, pero no han sido olvidados. Siguen siendo recordados positivamente. Nos acordamos de el carácter que traían, que fueron buenas personas, no nomás fueron unas personas que tuvieron un problema con la adicción, fueron hijos, fueron padres, hermanos, tíos, fueron trabajadores, fueron compatriotas de nosotros, y hay que recordarlos y levantarlos y no dejar no olvidarlos. Muchas gracias. I'm gonna leave an obituary right there for Victor.
Muchas gracias por submitir nombres de las personas que ya no están con nosotros, pero las queremos reconocer. So yeah, we have some submissions of names, and thank you all so much for sharing their names with us and to having us recognize them for the day of today.
I'll light the first candle for Brianna Betancourt Esquilon.
Mm-hmm. Lighter.
Okay. The next candle is lit in memory of Javi. And this next candle is lit in memory of Vivi.
Vamos a prender una vela para Joe. I'm going to light a candle for Joe. Y la otra vela la vamos a prender para Phyllis Martin, para Phyllis Martin. The next candle we're going to light is for Phyllis Martin.
And then I'm going to light one candle in memory of all of the clients and friends and colleagues that I have lost to overdose over the years in doing this work.
John va a prender una vela para todos sus colegas y todas las personas que él ha conocido que ha perdido por sobredosis. And I'll light the last candle for the rest of the people that we weren't able to name today, but we've lost due to overdose. Y la última vela que voy a prender va a ser para las personas de que no pudimos nombrar hoy, pero hemos perdido por sobredosis.
All right. Well, thank you very much for joining our Facebook live stream. Thank you for participating and asking questions and submitting names. We hope you have a really great rest of your Monday. And if you ever need any services and support from Haas or from us, please feel free to reach out.
Muchas gracias a todos por tener este tiempo con nosotros. Si necesitan cualquier información o tienen alguna pregunta, nos pueden contactar a nosotros por Haas o por número de teléfono. Les damos más información. Muchas gracias.
All right, y'all. Have a good one.
Thank you.